As I have told you how to hold this clavicle. Somebody. Play the dictum in your mind. Above and below is known by, lateral and medial is known by, anterior and posterior is known by. Medial 2/3 will be convex forward. Lateral 1/3 will be concave forward. Medial is heavy, rounded, quadrangular, rounded or quadrangular. Medial 2/3 will be convex forward. Lateral 1/3 will be concave forward. Lateral end will be flattened from above below. Medial end is heavy and quadrangular to rounded. Alright. Inferior surface is known by the subclavian groove, and at the junction of the posterior surface and the inferior surface there is the conoid tubercle from which a ridge runs. Give me. At the junction of the posterior surface and the inferior surface. This is the posterior surface. This is the inferior surface. Alright. This is medial, quadrangular or rounded and heavy cartilaginous origin part. Right. This is membranous part, flattened above and below. Right. The anterior 2/3 of the anterior part of the medial 2/3 is convex forward. The anterior part of the lateral 1/3 is concave forward. So anterior posterior is done. Right. Superior and inferior is known by, there will be a subclavian groove in the inferior surface. Right, and there is a tubercle at the junction of the inferior surface and the posterior surface of the lateral 1/3, which is known as the conoid tubercle, for the attachment of the conoid part of coracoclavicular ligament, and from there runs a ridge forwards and lateral like this, like my finger. All right, from this tubercle, this ridge runs like this. All right, this ridge is called the trapezoid ridge, or the trapezoid or the quadrangular part of the coracoclavicular ligament. Right. So this is of left-sided clavicle. Now anatomical position, when you are going to hold it in anatomically, you will hold it like a pen holding fashion. While we hold a pen, what is done? The tip is downwards, forwards and medial. The tip should be downward, forward, and not like this. This should be a little forward. Alright. So naturally this part goes up. Yes or no? If you hold like this. So the lateral end will be a little, number one, posterior and upward. This is for male. But for female, though the anterior end is in more anterior plane than the posterior end, but this upward inclination is not present in case of female because of lack of muscular exercises. Alright, this is almost horizontal, but this anterior part is more in the anterior plane. Got my point? As we write, what it becomes? The tip becomes forward, medial, and in the anterior plane. The lateral end is backwards, upwards, and laterally. Alright, but for female, though this part is anterior, in more anterior plane, but this part is not that much higher up. Alright, so you can hold it for a female bone, you can hold it in a horizontal plane also. What's my point? You hold it in pen holding fashion. There are another thing which we hold in pen holding fashion, that is the ribs. The rib we also hold it in pen holding fashion like this, keeping the posterior end a little higher up and the anterior end forward, downward and medial, forward, downward and medial. What's my point? This is the position of a rib. Right. Now you know the parts of the rib. That is, you should describe rib as a carved flat bone. Ribs are flat bone. Alright. So this is carved flat bone. It has an anterior end, posterior end, alright, and a shaft or carved shaft or a body, right. The anterior end in original bone, this surface remains rough due to the part of the cartilage, there is the costal cartilage attached to it, alright. So you don't keep this anterior end exactly in the median plane. You should always, because sternum is up to this much, alright. So sternum should be avoided and the part of the costal cartilage must be avoided, right. So this is the posterior end, alright. This goes to the lateral part of the vertebra. I will show you the articulation. I will show you. So this is the sternum. Keep a breath from the medial plane this much, and another part for the costal cartilage. So this should not, you hold it keeping this end into the medial plane of your body. You will keep more away from the median plane. One part is the half of the sternum and the other part is the costal, corresponding costal cartilage. Got my point? Now you see this part in original bone, you see it is roughened because the costal cartilage has been liquefied. After putting this in the acid solution, this part melts away. So this part remains irregular. Got my point? In original bone. So you can understand which one is the anterior end and which is one is the posterior end. Alright. For any rib, during the development from lower vertebrate to higher vertebrate up to the level of the birds, rib was like this. Alright, this is called the capitular head. This is called the capitular. I have told you capitate, caput, this being the head. Alright, so this is called capitular head. That is a real head. Alright, this is called upper or lower head, capitular or lower head. This is tubercular or upper head. Right, this is called the uncinate process. Uncinate means like the sickle, কাস্তের মতো, ঠিক আছে? Uncinate process. And this is the anterior end. This is posterior end. Posterior end. And this is the carved shaft. So initially all the ribs were bi-headed. Initially, during evolution, from the lower vertebrate to the higher one, up to the level of the birds. Birds is just below the mammals. You know the evolutionary ladder? That is the fishes, amphibian, reptiles, birds and the mammals. So immediately below mammals are the birds. Up to the level of the birds, we see this kind of bi-headed rib. We see this kind of bi-headed ribs with the uncinate process. Got my point? You will see in case of the birds, the two heads are like this. Alright, two heads are like this, and the unsigned process is communicating with the rib above, because due to their frequent exertion of these wings, they need the ribs to remain much more stable, expansive but stable. Got my point? For this arrangement, there are two attachments. Let me show you a thoracic vertebra. Yes. In thoracic vertebra, you will find. Let me describe a vertebra first. All right. Then I will go to this part. Whenever you are asked what a vertebra is, you will say vertebra has a cylindrical body. It has a small cylindrical body. All right. Together with a neural arch or a vertebral arch, neural arch or vertebral arch, enclosing in between a foramen, enclosing a foramen in between these two, that is in between the body and the neural arch or the vertebral arch. You see the above picture. This one is the body, this one is the body, and this whole part is the neural arch or the vertebral arch. Alright, from where we can see the transverse process, this lamina, this part attached to the vertebral body posteriorly is called the pedicle. This part is called the pedicle. This anterior part of the attachment of the neural arch to the body is called the pedicle, right? And then comes the pedicle with the junction of the transverse process. These two are the transverse process, right? And at the junction of pedicle and transverse process, there are two superior and inferior articular processes. These are the superior articular processes, and these two are the inferior articular processes. Got my point? And you see this lamina, this part is pedicle, this part is lamina. This lamina fuses posteriorly, enclosing a foramen, that is a vertebral foramen. Got my point? This is the vertebral foramen. And these lamina are fused posteriorly and extended backward, which is known as the spine. Which is known as the spine. And at the end of the spine, you will see there is a globular process, which is known as the spinous process, like this. Sometimes it may be bifid, as in the cervical vertebra. There is a short note by spina bifida. All right. So spina bifida is commonly found in the cervical vertebrae, except C7, because C7 is the junction from the cervical vertebra to thoracic vertebra. So C7 vertebra will assume the shape of a spine. Its spine will assume the shape of a thoracic vertebra. What's my point? That's why C7 spine is not bifid. It's a long one, and this is the first anatomical landmark. If you flex your head, all right, if you flex your neck, the first anatomical landmark is the prominent C7 spine. All right, you go on palpating, you will find a bony projection. All right, first bony landmark. Can you identify? Could you identify it? Flex, gently flex, go on in the midline, and you will find a bony projection. First bony projection, it is the first bony landmark in the body. This is the spine of C7 vertebra. So below this will be T1. So in case of the thoracic spine, you will see these spine are long, broad, and sloping downwards obliquely, not bifid, as in case of the cervical vertebra. All right, up to C6, not the C7. C7 has assumed the shape of thoracic vertebra, where the spine is not bifid. What's my point? Now, cervical vertebra is identified by only one character is enough. That is, there is a foramen transversorium in its transverse process. Foramen transversorium. How it is formed, I will tell you later, or it's not needed that much. So cervical vertebra is identified by bifid spine, triangular foramen, vertebral foramen, and a foramen in the transverse process, that is the foramen transversorium. So you can easily identify a a cervical vertebra, no problem. All right. Now, in case of the thoracic vertebra, there will be no, number one, there will be no foramen in the transverse process. Right. The body is heart-shaped. The body is heart-shaped. Right. And the vertebral foramen is a small one. You see, this is a cervical vertebra, so much small. This is a thoracic vertebra, so much large. But you see, the vertebral foramina, this is circular and small. This is triangular and large. Even you see, if you see the lumbar vertebra, you see, this is triangular and the larger one, more than a thoracic vertebra. Can you see it? That's my point. So without doing anything, if you can remember this, only this description of the foramen, you can identify this is the lumbar one, this is the thoracic one, this is the cervical one. That's my point. Now, other than this, the heart-shaped body, we see there is a oblique, downward and broad spinous process. Right? The pedicle is very short and thin. In case of thoracic vertebra, the pedicle is very short. You see, you can clearly identify the pedicle part. Right? But in this, pedicle is almost attached to the body, posterior aspect of the body. So, pedicle is short and it becomes thickest as we move downwards from upper thoracic vertebra to the lower thoracic vertebra. This pedicle becomes thicker one, all right, but short. It remains short, all right. Now, the transverse process comes out at the junction of the pedicle and the lamina. This part is called the lamina. After the pedicle and transverse process, this is the junction. This part is the lamina. Lamina of both sides fuses, all right, like this, and makes the spinous process. This is the spine, all right. And from the junction, two things come out. Number one is the transverse process, and number two is the superior and inferior articular process. This is the superior articular process. This is the inferior articular process. Got my point? From the junction of the pedicle and the transverse process, we see two pairs of zyga apophysis. What we see? Zyga apophysis. All right. Zyga apophysis. Zyga means paired or yolk. All right. Apophysis means this is an offshoot of bone without a separate ossification center. Write down what is the definition of apophysis. You have learned epiphysis, which comes from separate epiphyseal center, ossification center. The diaphysis has separate ossification center, sometimes two as in the clavicle, or mostly in the one as in the long bone for diaphysis. And there is the epiphysis, diaphysis, and the close to the epiphyseal cartilage or the growth plate, the part of the diaphysis close to the epiphyseal cartilage is called the metaphysis. These three things you know, epiphysis, metaphysis and diaphysis. All right. Now, I am giving you another term, that is apophysis. Apophysis is a offshoot of a bone without a separate ossification center. You see this, without a separate ossification center. This tubercle, this is the greater tubercle, the lesser tubercle, these are also apophytic bone. These are also apophytic bone. Got my point? Without a separate ossification center. What happened? If you see close to Calcutta is the center. Calcutta is the central place, central city. All right. Around this, there are many townships like Barashat, all right, like Srirampur, Hugli, Uttarpada in Hugli, all right, Chuchura, Chandanagar, like this, and close to this also Nadia. These are also close to this, all right. Of these parts, nothing developed as a proper township, but some part of, at least some part of Barasat has developed as a proper township without a separate center, like an airport, a central railway terminus. Barasat didn't have a central railway terminus or an airport like this, all right. But Barasat had developed to some extent as a city-like feature, isn't it? So it didn't remain as a town. It has become just like a city. What my point? This is called the apophyseal part of apophyseal growth of a bone. All the tubercles, the greater trochanters, lesser trochanters, the greater tubercle, lesser tubercle, all these are called apophyses. What my point? This is apophysis. Alright. So why these are paired and yoke like, yoke মানে জোয়াল গরুর কাঁধে যেটা চাপিয়ে দেওয়া হয়, ঠিক আছে? Zugam or zyga means the yoke, that is the paired part. Alright. These are called zyga apophysis. These two, superior articular process and the inferior articular process. As in case of ungulates or the quadrupeds, the vertebrae is like this. Yes or no? This is the cranial end, this is the tail end. This is the cranial end, this is the tail end. This is the articulation between two subsequent thoracic vertebra. So this is the head end or the cranial end, this is the tail end. Alright. So these two superior articular process are called pre-zygoapophysis. Pre means towards the cranial end. Considering the quadruped ventroflex position of the quadruped animals, alright, like the cattle, goat, cow, sheep, buffaloes. Got my point? So this is the pre-zygoapophyseal process, and these two are, the lower two are post-zygoapophyseal process. You can call it superior articular process or inferior articular process according to the mammalian position. But you should know that these are the pre-zygoapophyseal process and post-zygoapophyseal process. Superior one is the pre-zygoapophyseal process and inferior one is the post-zygoapophyseal process. Pre means towards the cranial end, this is the superior, and the post means towards the tail end or the inferior in case of the mammal. Got my point? So you have come to know two different terms. One is zyga or zugam and another is the apophysis. Alright, you have learned you know what types of epiphyses are there. What is the classification of epiphysis? Epiphysis is a very important Viva question, and also it comes as a short note, 5-mark short note, epiphysis. Tell me what are the types of epiphysis? Pressure epiphysis, traction epiphysis, aberrant epiphysis, atavistic epiphysis. The first classification is the simple epiphysis and compound epiphysis. What is simple epiphysis? When a epiphyseal center, this for head, one epiphyseal center for head, one epiphyseal center for the greater tubercle, another for the lesser tubercle. Alright. In femur also you will get one for the head, one for the greater tubercle and one for the lesser tubercle. Remember, in case of the head of the humerus, alright, first these three joins together, then the compound epiphysis joins with the sap. First this one joins together. So what does it make? A compound epiphysis. Then that compound epiphysis joins with the sap separately. This is compound epiphysis. But in case of femur, what happened? The head, the greater tubercle, the lesser tubercle, all unite separately with the sap. So they are simple epiphysis. Got my point or not? As these are joining together themselves, forming a compound epiphysis, then joining with the sap. So this is a compound epiphysis. But in case of femur, the head, the greater trochanter and the lesser trochanter, though are arising from separate epiphyseal center, but they are joining with the sap separately. So they are simple epiphysis. Got my point? And one day I will describe the lower end of the humerus, which should be called a compound epiphysis, because here simple epiphysis is present, compound epiphysis is present, as well as direct continuation of the diaphysis is also present. Connecting this simple and compound epiphyseal part. Got my point? The simple epiphyseal part, compound epiphyseal part, and these two are connected by a prolongation of the diaphysis in between. So you can call it a complex epiphysis. The lower end of humerus is a complex epiphysis. Alright, you know the pressure epiphysis, traction epiphysis. Which epiphysis appears early during the development of a bone? Pressure epiphysis or traction epiphysis? Which epiphysis appears first? Pressure epiphysis or traction epiphysis? Two choice. Hold it or it. Make yourself blindfolded. Pressure epiphysis appears first, then the traction epiphysis. Because traction epiphysis develops primarily for the attachment of for the action of the muscle pull. There is much more interesting thing. If you cut the developing myotome going to be attached to the traction epiphysis, even then the traction epiphysis develops. What's my point or no? What we are calling, these epiphyses are formed due to muscle pull. If during development myotome is developing, alright, you have cut the connection between the bone and the muscle. Till then, the traction epiphysis will develop. So it is not the, so traction epiphysis, the tractional pull of the muscle is a secondary influence, not the primary influence for the growth of the traction epiphysis. Got my? And you know about the atavistic epiphysis, the aberrant epiphysis. Atavistic epiphysis, which one is an atavistic epiphysis? Coracoid process of scapula is an atavistic epiphysis. This is a separate origin bone with separate ossification center which has attached to this bone secondarily for nutrition. This is called atavistic. Atavist means to recall. It was originally another bony framework of which it was a part. But in this bone, it takes a secondary attachment. That is called a atavistic epiphysis. And there is another term called aberrant epiphysis. What is aberrant epiphysis? This is another separate bone, alright, which doesn't remain separate from the mother bone, alright, though it is a part of the mother bone, part and parcel of this mother bone, but initially it is not attached with it, and it secondarily attaches with the mother bone. This is aberrant epiphysis. There is another term also, accessory epiphysis, that is, as you know, that is the head of the metacarpal bears the epiphysis, and at the base there is no epiphyseal center. All the metacarpals, 4 metacarpal, has their epiphysis at the head. The knuckles are the epiphyseal head, not the first one. Alright, for the first one, the epiphyseal center is at the base, just like the phalanges. In case of the phalanges, the epiphyseal center is at the base, not at the head. For every phalangeal, that is the proximal phalanges, intermediate phalanges and distal phalanges, the epiphysis is at the base, not at the head. But the metacarpal has epiphysis at the head, not at the base. But in case of the first metacarpal, that is the metacarpal bone for the thumb, the epiphysis is like the phalanges. Epiphysis where? For the phalanges? At the base. For the metacarpal, rest of the metacarpals at the head. But for the masked metacarpal, it is like a phalanges, that is at the base. Got my point? So that's why first metacarpal is called a modified phalanges. First metacarpal is called a modified phalanges. This comes also as a short form. This also comes as a short form. Alright. Then what is accessory epiphysis? Accessory epiphysis is, though there being an epiphysis at the base of the first metacarpal, there could be another epiphysis at the head, resembling that of the other metacarpal. Got my point? The phalanges has epiphysis at the base, not at the head. The metacarpal, 4 metacarpals has epiphyses at the head, not at the base. The first metacarpal is like the phalanges. Its epiphysis is at the base, not at the head. But sometimes an epiphyseal center arises at the head also, resembling that of the other metacarpal. This extra metaphysis, epiphysis is called an accessory epiphysis. Alright. So this is the classification of epiphysis, and today you have understood another term, that is the apophysis. Got my point? So superior articular process, if you hold it like the quadruped ventroflexed animal, this is the head end, this is the tail end. So this is called the pre-zygoapophyseal process. This is called the post-zygoapophyseal process, the inferior one. In case of, alright, if you hold it like this is the pre or the superior, this is the post or the inferior. Alright, and you see the attachment I have shown you in that diagram. Can you see it? The inferior articular process, the superior articular process of the succeeding bone with the inferior articular process of the preceding bone. This is the articulation. Got my point? This is the articulation. Now, what is important is that just in front of the pedicle and the body, at the junction of the pedicle and body, there is a notch. In front of the, this one is the pedicle and this is the body. In front of the pedicle and the body, there is a notch. Alright. And below, near the inferior border of the vertebra, inferior border, there is another notch in between the inferior articular process and the body. Can you see it? One notch is above, one notch is below. Alright. When this is articulating with the vertebra above or below, these notches are converted into intervertebral foramen. This is the vertebral foramen, these are the intervertebral foramen, through which the spinal nerve comes out. Remember, the upper notch gives the passage for the corresponding spinal nerve. Write it down. The upper notch gives the passage of the corresponding spinal nerve. No. Preceding spinal nerve. Preceding spinal nerve. And the notch below gives rise to the passage of the corresponding spinal nerve. Why this is? Why this is? You see, we have 7 cervical vertebra. Yes or no? 7 vertebra, but cervical spinal nerves are 8. Cervical spinal nerves are 8. Got my point? So the 8 will pass above the first notch of the thoracic vertebra. There is the C7 spine, C7 vertebra, and the T1 vertebra, the intervertebral foramina between the C7 and the T1 will give the passage of the C8 nerve. So the T1 vertebra, upper notch of the T1 vertebra is giving rise to the previous nerve, preceding nerve, and the lower one will give rise to the passage for the T1 nerve. Got my point? So the upper notch is giving the passage of the preceding nerve, the lower notch is giving the passage for the corresponding nerve. Got my point? These are very simple things, but we get easily confused. Got my point? Now, there are 2 other things, that is, when this, as you see in the ribs, when this tubercular or upper head get gradually diminished, this becomes the tubercle of a rib. This tubercle is actually the diminished tubercular head of a rib. Got my point? This is the tubercular head of the rib. This has become the capitular head or 2 head for a rib, and this has become the tubercular head. Got my point? And the part between the between the tubercle and the head of a rib is the neck. This part is called the neck. Got my point? And the rest of the part is the shaft. And this is the anterior end where you see uneven surface for the attachment of the costal cartilage. Got my point? Now there is another property of these ribs are that if you see a rib, for the purpose of holding it anatomical position, the larger part is the medial or the dorsal part, posterior part. The roughened anterior part, which is for the attachment of the costal cartilage, is the anterior end. This is the posterior end. At the posterior end, projecting posterolaterally is the tubercle of the rib. Right? And after that there is a posterior angle. After that there is a posterior angle beyond the tubercular part. Alright, got my point? And at the end of this this posterior angle, there is the attachment of this uncinate process. This is the posterior angle after the tubercle. Alright, at this end, the uncinate process is present in case of lower vertebrae. Then comes the proper, and there is one anterior angle also. Alright, I have said you that this spinous process projects posteriorly. So in case of the quadrupeds like dog, cat, the cows, the buffaloes, they can't sit in a supine posture because this spine will touch the bed. But in case of the human being, what happens is this posterior angle goes beyond. This is the spinous process. Suppose this is the spinous process. This is the spinous process. In case of lower vertebrates, this will, if you try to lie supine, this will touch. But in case of the human being, this ribs attaches like this. You see this attaches like this. It goes beyond the tip of the spinous process. So if you lie supine, this posterior angle will touch the bed, not the tip of the spinous process. Got my point? And this part, in case of the thorax, this posterior angle gives the placement of the posterior thick border or rounded border of the lung. Posterior thick or rounded border of the lung. And in case of the abdomen, these are known as paravertebral gutter. These are known as paravertebral gutter. Just by the side of the vertebra, there are blood vessels, that is IVC or the abdominal aorta. Alright. Outside that, there is the paravertebral gutter contains the ascending and the descending colon. Ascending and the descending colon. What's my point? What's my point? This paravertebral gutter, in case of the human being, in thoracic cavity, these give rise to the placement of the posterior rounded and thick border of the lung. What's my point? And in case of the abdomen, this paravertebral gutter forms the lodgement, takes the lodgement of the ascending and descending colon. Got my point? Now another thing you see, these ribs, the upper border is not a sharp one, but the lower one is a sharp one. Hold it, each and every. So the upper border is a blunt one, broader one, and the lower border is a sharp one. Alright. And just above this sharp lower border, you will find a groove. Just above this lower border, thoracic vertebra, first we look for the heart-shaped body. Right? Next is the vertebral foramen, in between the vertebral body and the vertebral arch or the neural arch. The neural arch is subdivided into number one, the pedicle, just behind the body. Then at the junction of the pedicle and the lamina, there is the transverse process, superior articular process and the inferior articular process. Right? And beyond that part that is enclosing the vertebral foramina is the lamina. And the part where the lamina fuses with each other is the spine of a vertebra. Got my point? In case of cervical vertebra, as you can see, it is much larger and triangular. But in case of thoracic vertebra, it is much smaller and circular. What's my point? Cervical vertebra can be easily understood by the foramen transversorium. By the foramen transversorium. And up to C6 vertebra, the spine will be bifid. The spine will be bifid. Why not the C7? Because C7 is the transitional vertebra. It is going to assume the characteristic features of a thoracic vertebra. Thoracic vertebra spines are not bifid. Okay. These are long and oblique one overlapping with each other. These are long and oblique one overlapping each other. As you see, this part is called the pedicle. This part is called the lamina. Arch rotates around the axis. What's my point? And you see, this is what? This is a no joint. This is a atlanto-axial joint is the no joint. We say no by moving this. This is called the transverse or the horizontal pivot. What's my point? Where the axis is fixed, but the arch or the rim is rotating. This we do when we say no. Alright, but in case of the atlanto-occipital joint, it should not fit, as I believe. This is a larger one, this is a smaller one. Alright, this joint between the occipital condyles of the occipital bone and the superior articular process of the atlas. This joint is a yes joint because this nods like this. This nod like this. Right? So, atlanto-occipital joint is a yes joint. What's my point? This condylar variety of joint is a yes joint. And the atlanto-axial joint is a horizontal pivot causing the no joint. What's my point? And one thing more is I have said that the inferior petrosal sinus is the first tributary of the internal jugular vein. Where lies the inferior petrosal sinus? You see, this is the petrous part of temporal bone. You will read it. I don't need to tell you everything. All right. This is the transverse process. This curved part is the sigmoid process. Sigmoid sinus. This is the transverse sinus. Here lies the occipital sinus. All right. You don't need to remember. Just see these impressions. All right. This is transverse sinus. This curved one is the sigmoid sinus. And after the sigmoid sinus, it enters through the jugular foramen. This is the jugular foramen. It is continued as the internal jugular vein. This is continued as the internal jugular vein. And this is the position for the superior petrosal sinus. All right. Just I wanted to show you this thing. All right. As I have mentioned. All right. And the horizontal or the transverse pivot joint that I have shown you. All right. Determine its side and hold it in anatomical position. Determine its side and hold it in anatomical position. Here's the dictum. Above and below known by, anterior and posterior is known by, lateral and medial is known by. तो दो ही तो है, एक बार यहाँ रखो और एक बार यहाँ रखो, उल्टाते रहो, ठीक हो जाएगा एक बार ना एक बार. Right side. Tell me the criteria. Lateral. Give me the bone. This is also lateral. This is also lateral. This is also lateral. Will be dorsally placed. Above and below is known by the superior angle is a sharp one and the inferior angle is a blunt one. Anterior and posterior is known by ventral surface or the costal surface is a concave forward with the imprints of the ribs, and the dorsal surface there is a spine, self-like projection of a bone which is known as the spine that divides the dorsal surface into supraspinatus fossa and infraspinatus fossa. The base of the spine indicates towards the vertebral border, thin vertebral border medially, and the thick border below the glenoid is the lateral border. Glenoid looks upwards, forwards and lateral, and it makes the lateral angle or the head, right? So this is of right side. If you reverse it, the ventral and dorsal surface will reverse. All right. If you make, even people have hold it like this. All right. Even the heart, you know, I was looking at them. This is the heart. This is the gentle placement of the apex. First he put just like this. Then I said just make it gently lateral. He first make this and started to spinning it. All right. Now hold it in anatomical position. आप इसको पकड़ो. Hold it in anatomical position. What is its anatomical position? हाँ आप नहीं ऐसे anatomical position ऐसा नहीं है. All right. It is a revolver holding fashion. All right. Where we put our index at the neck. All right. As if this is the trigger, the supraglenoid notch. All right. This is the trigger. And you don't put the nozzle just like towards the examiner. Or if there is a misfire, the examiner will be gone. All right. So with due respect, you tilt it gently lateral. Not that much. All right. Make it gently lateral. This is because as you know, the ribs are like this. If it is placed here, so what will be its anatomical position? Can you see it? If it is here, what will be its anatomical position? Not anterior posterior, not in the anterior posterior plane, but like this. Can you see this? What is the position? It is tip of the coracoid process is gently lateral. Got my point? So the lateral border or the axillary border is a thick one, vertebral border is a thin one, where the base of the spinous process indicates the vertebral border. All right. The self-like projection on the dorsal aspect of the bone is the spine, which has an upper border, lower border. Lower border is continued anteriorly, making an angle of 90 degrees, which is known as the acromial angle. This is the acromial process, this is the spinous process, and this is the coracoid process. And you have to hold it in this position, revolver holding position. Done. All right. Now clavicle. इसको पकड़ के दिख. Hold it in anatomical position. Determine its side and hold it in anatomical position. Left. Left clavicle. How can you tell it?
So
it remains left.
no, sir. Concave and convex.
So the medial 2/3 of the clavicle will be convex forward. Above and below is known by anterior, and posterior is known by lateral, and medial is known by. All right. The globular or quadrangular heavy is the medial end. The flat end from above below is its lateral end. Anterior 2/3 surface of the clavicle will be convex forward, and the lateral 1/3 will be concave forward. All right. And in the inferior surface, we see a groove, that is a subclavian groove, where lies the nutrient foramina. Right. At the junction of the inferior surface and the posterior surface, there is a tubercle, which is called the conoid tubercle, that gives the attachment of the conoid part of coracoclavicular ligament. And from this coracoclavicular ligament downwards and laterally, just follow my finger, runs a reed, which is known as the trapezoid reed, that gives the attachment of the trapezoid part of the coracoclavicular ligament. As I have told you, the anatomical position is a pain holding fashion. How do we hold our pain? The anterior end is lower and forward, posterior end is upwards and backward. So hold it first horizontally, push this anteriorly, make this in upwards. Alright, and hold it in pain holding fashion. Got my point? As I have told you, in case of the female, though the anterior is more in the anterior plane than the posterior end, but the acromial end doesn't lie that much higher up than the anterior end, sternal end. Right? It is almost horizontal. Got my point? So this will be its anatomical position. Done? I will repeatedly ask these simple things. Alright? What I was talking about? Vertebrae. Alright. As you know, we have how many vertebrae are there? 26. The definition of 26 vertebra. There is a definition for 26 vertebra also. By segment vertebra are 33. And by individual bone piece it is 26. 7 cervical, 12 thoracic, 12 plus 7, 19, 5 lumbar, 24, 1 sacrum, 25, 1 piece of coccyx, that is 26. So by individual piece of bone, or it may be 25 even when the sacrum and coccyx get fused. And but by vertebral segment it is 33. How many spinal nerves are there? How many spinal nerves are there? 33 vertebrae by segment, and there are 31 pairs of spinal nerves. 33 vertebrae are 7 cervical by segment, 7 cervical, 12 thoracic, 5 lumbar, 5 sacral fused together to form sacrum, and 4 coccygeal fused together to form the coccyx. Right? There are individual or the regional characters of the vertebrae. There are regional characteristics of all these vertebrae. In case of the cervical vertebrae, you can easily identify a cervical vertebrae by looking at the foramen transversarium. That is a foramen within the transverse process. Right? Through which the vertebral artery passes. Through which the vertebral artery passes. If there is no foramen transversarium, it is not a cervical vertebra. Alright. Now come to the thoracic vertebra. Alright. You see that heart-shaped body, the small circular, this foramen, as you see, it is a large and triangular one. The bone is so small, but the vertebral foramen is a large and a triangular one. Isn't it? It's a larger bone in comparison to the cervical bone. But you see, the vertebral foramen is circular and small. Right? As you can identify through the foramen transversarium, you can identify these by the facets for the ribs, both in the body as well as in the transverse process. So presence of facets, either in the body, upper and lower margin of the body, or in the transverse process, that makes a typical thoracic vertebra. Alright, look at this upper border. As I've told you, this part of articulation with the vertebral arch and neural arch with the body is called the pedicle. So one demifacet or the hemifacet, alright, will be in front of the pedicle in the upper border of the body of the vertebra, and one demifacet in front of the inferior notch. This is the superior notch, which is shallow one, and the inferior notch is a deeper one, and there will be another demifacet in the lower border, close to the lower border. So 2 is here, 2 is here in a typical vertebra, and another pair is at the transverse process, not occupying the whole of the tip of the transverse process. There is a part which lies beyond this articular facet. Got my point? You see, I have drawn the whole of the transverse process is not the articular part. There is a white part, a little white part I have kept in this diagram, that diagram. The whole of this tip is not this part is not occupied by the articular facet. All right, there is a part beyond this. And these transverse processes of the, so pedicles are short, body heart-shaped, vertebral foramina is small and circular, pedicle is short, the transverse processes are club-shaped and directed posterolaterally. This is club-shaped and directed posterolateral. And in typical vertebra, there will be a facets for the rib. Got my point? You see, these are not the original bones, so I am unable to show you the basivertebral foramen. This is the vertebral anterior part. All right. This is the posterior part. This is the anterior boundary of the vertebral foramina. There lies a foramen, which is not present here because it is. These are ceramic bones. You see the marked area? I shouldn't mark it. I will. There should lie a foramen. That is called the basivertebral foramen. I put it. Okay. All right. I put it to show you here. Sorry. No. You see. I will take your support. This is the position of the behind the posterior surface of the vertebral body. This is the location of the basivertebral foramen. This is the location of the basivertebral foramen. All right. What happened? The vertebra is not segmentally developed. Vertebra is not a segmental development. You know that the paraxial mesoderm. You know about paraxial mesoderm? Intermediate cell mesoderm, lateral plate mesoderm? No. How far you have read in embryology? এমব্রায়োলজিতে কত দূর হয়েছে এখনো আসেনি হ্যাঁ ফার্টিলাইজেশন তো কবে আজ থেকে 1-1.5 মাস আগের কথা হ্যাঁ
Third to 8 week of development.
3rd to 8
week of development.
হ্যাঁ 4th week 8 week মানে 22nd week হলেই তো সোমাইট কি বলে সোমাইট ফর্মেশন হয়ে যায় 22 ডে হয়ে গেলেই সোমাইট ফর্মেশন হয়ে যায় So there are segmentation of the paraxial and intermediate cell mesoderm. All right, that gives segment. You have seen the caterpillar. All right, there are segments, isn't it? Like this, our body also get at least 21 plus segments, craniocaudal. All right, and from each segment, the corresponding somites. For each segment or somite, the corresponding myotomes develop. That is muscles for the intercostal, right? The segmental muscles of the transversus abdominis. All right, transversus abdominis though is a strap muscle, longitudinal strap muscle, but there are intersections because it has also developed segmental. What's my point? Now these segments are giving rise to a part.
Sorry, sir. ऐसे करके दिखा देंगे
This is a somite, a segment, all right. This is the mesodermal somite. This is the amniotic membrane side, that is the ectodermal side. This is the yolk side, that is the endodermal side. All right. And you see by the side, this is the developing neural tube from the neuroectoderm. And this is the notochord that will give rise to the vertebra. All right. And by the side of this notochord and the neural tube, we see this is the paraxial mesoderm. This is called paraxial mesoderm, which is divided into dermomyotome. This is called dermomyotome, and this is called sclerotome. And in between this, there is a myelocele. All right. This is the coelomic cavity that separates. This is the intermediate cell mass. This is the intermediate cell mass. What's my point? That gives rise to the development of the kidney, the urogenital system. All right. And this is the lateral plate mesoderm. This part is the lateral plate mesoderm. What's my point? Hey? Now from this sclerotome, from this dermomyotome, the dermis of the skin will develop. From this dermomyotome, the dermis of the skin and the superficial muscles of panniculus carnosus. Did I call you what is panniculus carnosus? The whole muscle seat that is present in the lower vertebrates. That's why they can vibrate any part of their skin area because of the subcutaneous muscle. It is continuously present in case of the lower vertebrates. All right. But in case of us, there are some part remaining as a remnant. All right. That is the facial muscles, the platysma, the nipple and areolar part, the dartos muscle of the scrotum, corrugator cutis ani of the anal aperture. All right. These are the, and the palmaris brevis. And the palmaris brevis. All right. These are the remnants of that panniculus carnosus. Right. That, and the dermis has got all the dermis and the dermal muscles are developing from this dermomyotome. It has dermal part and the myotomic part. All right. And this sclerotome, from this sclerotome, the cells migrate around the notochord. Right. These give the primary, or the first is the membranous part of vertebral development, then comes the cartilaginous stage of vertebral development, then comes the osteogenic development of the vertebra. All right. In case of, if you, this is a transverse section, if I make it like this, for each somite, what happened? For the each somite, the upper part is a light one, the lower part is a dense one. The upper part is a light one and the lower part is a dense one. Right? And this part fuses. The denser part of the upper somite with the lighter part of the lower somite.
Yes, sir.
These two joins to form a vertebra, a vertebral body. All right. And the part that lies in between, this denser and this part, here is the formation of the vertebral disc. Here is the formation of the vertebral disc. So if this is one vertebra and this is another vertebra, this will form another, oh sorry. So the denser part of one somite segment and the lighter part of another somite segment are fusing to form the vertebral body. So if these are the segments, the formation in between these two is intersegmental. So development of vertebra is intersegmental. I will talk about ribs and the vertebral arteries. later on. All right, you just remember this part. Then I will tell you what happens when what happens. All right, I will tell you later on. All right.
Okay, sir.
So where I was. So here lies the central part, occupies the notochord, around which the polyhedral cells from the sclerotum migrates to form the centrum, not the body first, the centrum. All right. And from there, this is called hypochondral bone. This is called hyperchondral bone.
Yes.
Right?
Yes, sir.
From there, two lateral processes comes and two dorsal processes come. Two lateral process, all right, and two dorsal processes come. These hypochondral bone and hyperchondral bone are fused with the part around the centrum of the notochord. Got my point? This is the centrum, and this part, when this part attaches with the centrum together with a part from the pedicle, this forms the body of the vertebra. Not the centrum is the body of the vertebra. All right? This hypochondral bone and hypochondral bone attaches extra mantle or cortical bone to the body of the vertebra, and these two are the first one. Ventrally is the costal process. In case of thoracic vertebra, this costal process gives the ribs. The lateral process, this is the transverse process. These two are the lamina, and this gives rise to the spine. Got my point? This is the development of the vertebra. In short, this is the development of the vertebra in short. And remember, this is not segmental in development. This is intersegmental in development. All right. And where does the ribs attaches? The last part is the articulation of the vertebra. So you know the parts. This is transverse process. This is the pedicle. This is the superior articular process or the pre-zygoapophyseal process.
Yes, sir.
And this is the post-zygoapophyseal process. Why do we call it pre and post? And the thoracic vertebra, in case of quadrupeds, ventroflexed animal, this is the cranial end, this is the tail end. All right. These are the towards the cranial end. This is called the pre-zygoapophyseal zygoapophyseal process. In case of human being, it is superior articular process. This is the superior articular process. And this tail end, which is called the post-zygoapophyseal process, in case of human being, as it is vertical, this is called post-zygoapophyseal process. Right? You know the classification of epiphysis? Jano? This is another very important short note as well as a viva question. All right. And what is apophysis also? So from the neural arch, there is the pedicle, then the transverse process. At the junction of pedicle and transverse process, there are a pair of pre-zygoapophyseal process or the superior articular facets and the inferior articular facets. All right. And these transverse processes are directed posterolaterally, and these are clamped separate. And in typical rib, in typical vertebra, you will see there are costal facets. Costal facets just in front of the pedicle. Number one pair is on either side. In front of the pedicle, in front of the inferior notch, in front of the pedicle and in front of the inferior notch, and there is a articular facet on the transverse process. Got my point? And on the posterior aspect, I have drawn you the position of the basivertebral foramen. Right? These basivertebral foramen represent this junction. This basivertebral foramen represent the junction of the upper denser part and the lower the upper lighter part and the lower denser part, where the vertebral venous plexuses are communicated with. Where to the vertebral venous plexuses are communicated with. All right.
Yes, sir.
Let me conclude here. I will continue the next part. All right. Acha.